I'd like to just correct a few misstatements that have been made up until this point. First of all, early on it was talked about, and we've all heard about cost shifting, when people show up in emergency rooms without insurance and there's uncompensated care, and we hear politicians say over and over again, this is making us pay for it. Well, actually, that's been studied in depth. The center-left Urban Institute has found that uncompensated care from under the age of 65 patients probably raises health insurance premiums about 1.7%, and the nonpartisan Congressional Budget Office recently said that that uncompensated care accounts for about 2.2% of health care costs. The number one cause of cost shifting is not people without insurance showing up in emergency rooms. The number one cause of cost shifting is doctors making up for their decreasing reimbursements that they receive on Medicare and Medicaid patients by charging more to non-Medicare and Medicaid patients. As most people probably know, Medicare has had price control since 1983. Every year, doctors get a list of several thousand procedures and diagnostic codes and they're told in a one-size-fits-all manner. It doesn't matter whether you're the best in the country and done thousands of the procedures or it's your first one in private practice. It tells you this is what you're going to get for this procedure. And every year it goes down and down and down, which is one of the major reasons why we're having physician shortages this day. And whether it's primary care or other kind of specialties. And my specialty of general surgery is a 35% vacancy in residency programs. So that's first of all, I want to clear that up. It's the government-run healthcare system that constantly decreases reimbursements to balance its budget and is responsible for most of the cost shifting. Number two, this notion that preventative care is going to save us money. Preventative care is going to save us lives, that's no question. Preventative care is good for longevity, but it doesn't necessarily save money. In fact, many studies, including studies done in socialized medicine countries like Sweden, have shown that preventative care actually costs more because you get a lot of negative tests to discover one positive one, and the longevity that it creates actually leads to people getting more costly chronic diseases like Alzheimer's disease who would have died at a younger age. So the notion that preventative care is going to save the system money is really a fallacy. But let's do some comparisons. This is from Stanford University. Preventative care in the United States versus in Canada's single-payer system. 89% of American women have had a mammogram, 72% of Canadian women. 96% of American women have had pap smears compared to 90% of Canadians. 54% of American men have had PSA prostate screening tests compared to 16% of Canadians. Nearly one-third of Americans have had a colonoscopy compared to 5% of Canadians. And the final point I want to clear up is this notion that individual insurance costs so much more that you can't afford insurance if you want to go out on your own. Anybody in here in this room is certainly welcome to go on the internet and do their own market search. On average, if you go out and buy your own individual insurance, it's roughly 50% the cost of employer-provided family health insurance. And with that, I'll yield the balance of my time.